So endocarditis is the inflammation of the inner layer of the heart, including the valves. So what occurs with endocarditis was typically due to a foreign bacterial or fungal infection that travels into the bloodstream and enters and attaches to either the valves or one of the chambers of the heart. Typically, bacterial infections enjoy aggregating to the valves, such as the mitral valve or the left ventricles, for example, and vegetating, causing major issues that we'll talk about. The risk factors associated with endocarditis is drug use. Well, why is drug use a risk factor for endocarditis? Well, it's because drug users that inject drugs such as heroin, for example, and have heart issues will cause that piece of the drug to enter into the bloodstream and cause major issues within those valves and within the chambers. So that allows foreign objects such as bacteria to aggregate onto those valves or the ventricles and cause complications. The second risk factor is dental work. Typically, before a dentist appointment, the patient should explain that they had a valve surgery within their heart months prior, so before getting dental work. So dentists could provide antibiotics before the patient obtains dental work. So there are some complications associated with endocarditis. One of them is being congestive heart failure. Why would congestive heart failure be an issue? It's because if the valves of the heart are damaged and it's not working properly, therefore the heart would have to work much harder in order to compensate. And over time, the heart is going to become overworked and it's going to become tired, leading to congestive heart failure. The second complication is pericarditis. I'm going to explain the pathophysiology behind the inflammation, but with pericarditis, what's going to happen is that there's going to be the amount of neutrophils that's being sent to the site, causing the vasodilation, and the amount of fluid that's accumulating within that area is going to lead to pericarditis. And pericarditis has its own complications associated with it, and I'll talk about that within the next video. The third complication is uncontrollable infection. At a certain point, the infection is going to become very difficult to treat because the bacteria already vegetated that mitral valve, for example, or the left ventricle, and cause major issues. So typically patients would be placed on specific antibiotics, but we'll talk about the medications within this video. Okay, so for the pathophysiology behind endocarditis, let's say if a patient comes in for dental work and it doesn't explain to the dentist that they had heart surgery months prior. Well, this is the pathophysiology behind that situation. So the patient comes into the dentist, gets that dental work done, and if the patient was not placed on antibiotics prophylactically before getting that dental surgery, bacteria is going to travel from systemic circulation, let's say through the superior vena cava, through the right atrium. Now, this is the interesting thing. That bacteria is going to travel and pick wherever it wants to aggregate to. Typically, it likes to travel to the mitral valve, also known as the bicuspid valve, or the left ventricle. But let's say if it travels to the right ventricle and aggregates onto it, that can be an issue because if it travels into the right ventricle, there's different complications that's associated on what side of the heart the bacteria has aggregated to. So for example, if it traveled to the right ventricle, now what could happen is that here's our lung. The vegetation could break off, travel to the pulmonary artery, and into the lungs, causing a pulmonary embolism, causing a PE. So that's a complication if it aggregates onto the right side of the heart. Now, let's say if it aggregates onto the left side of the heart. If it aggregates onto the mitral valve, for example, it can cause systemic issues if that vegetation breaks off. Also, it's important to know that not only is there a vegetation on the valves or the ventricle, there's also platelets that's aggregated onto that valve or ventricle to maintain that cardiac output. So not only is the vegetation possibly going to break off, but also there's going to be a thrombus that could also break off too. Now, if it's in the left side of the heart and it travels out to systemic circulation, it's going to cause issues such as a splenic embolism, or it can also cause situations such as a stroke to occur. So different complications for different sides of the heart. So that's something that's important to talk about. Now, let's look at it at a cellular level. Okay, so let's say if this is our valve, it's been damaged due to the vegetation of the bacterial aggregating onto the valve. What's going to happen is that there's going to be inflammation, because neutrophils are the first white blood cells to reach the site. So neutrophils are the first soldiers to go to the site and fix the main issue. So we're going to see things such as inflammation, increased chest pain. So what's going to happen after that is that the neutrophils are going to send out cytokine messengers to vasodilate the surrounding blood supply. So we want to do that because when there's vasodilation, it's going to help maintain that cardiac output. But now the issue with it is that it's going to increase the amount of fluid within that surrounding area. Now, we spoke about how pericarditis is a complication of endocarditis. Well, this is the reason why. Pericarditis is going to be a complication of endocarditis due to the increased amount of fluid within that surrounding area due to the vasodilation of the neutrophils that's associated at the cellular level. So there are some objective signs to look for when dealing with a patient who has endocarditis. So the first objective sign is a new murmur with a high fever. So if you've auscultated this patient prior coming into the unit and you notice that there was no murmur before, but now present time you auscultate and you notice that there's a new murmur within the S3, S4 while listening with a high fever, that's considered to be a classic sign of endocarditis. The second objective sign is an Osler's node, which are considered to be red, painful pads of the fingers and hands and the feet. I'll place a picture right here. So the third objective sign are Janeway lesions, not to get it confused with an Osler node. These are considered to be red, painless palms of the hands and feet. And I'll place a picture here. Okay, so the fourth objective sign is petechiae. Those are considered to be round spots that are bleeding under the skin. The fifth objective sign are Roth spots. So this is when there's hemorrhaging of the retina, and what it causes, it ends up causing blurred vision. The patient may complain of not seeing right, a change in their visual acuity. So that's something to monitor for. So the sixth objective sign are clubbing the fingers. Due to low perfusion of the extremities, this is something that's typically seen with endocarditis. So if you see the nail beds are above 180 degrees, that's something to take note of. that the patient may have clubbing of the fingers. Okay, so for the diagnostics for endocarditis, well, first things first, we want to get a white blood cell count, because due to the increased amount of white blood cells within that vegetative site, such as neutrophils, we want to know what their white blood cell count, so it's important to trend that. Second lab that we really want to trend is ESR, because we want to know how much inflammation is occurring within that site of the heart, or just in general. We just want to know how the patient's inflammation is going. There's a set of blood cultures that we are supposed to take specifically for endocarditis. It's going to be 2 sets of that's going to be taken, one by the lab or one by the nurse. Depends on the situation. The 2 sets contain 1 blue bottle and 1 brown bottle. The blue bottles for aerobic bacteria, the brown bottles for anaerobic bacteria. The reason why there's 2 different vials is because if the brown bottle was used first, that's used for anaerobic bacteria, it can kill off the aerobic bacteria, which is what we don't want. So that's why we take the aerobic bacteria vial. We draw that blood work first, and then we do the brown bottle, just to be on the safe side. Within that time period, we're going to give the patient a broad spectrum antibiotics, because it's going to take 24 to 48 hours for those vials to cook up and to get the results of what the specific bacterial infection is. And then after that, we can give the patient specific antibiotics accordingly. The third diagnostic that's considered to be an imaging is an echocardiogram. It's going to give a clear image of the valves, the ventricles, and the chambers of the heart. We want to know how bad the vegetation is. We also want to know about the ejection fraction, especially since the complication of congestive heart failure is an issue with endocarditis. So we definitely want to know that. Okay, so what are the treatments for endocarditis? Well, as far as medications, broad spectrum antibiotics are typically given before actually knowing what the specific bacterial infection is. So within the first 24 to 48 hours, a broad spectrum antibiotic is given. And then after the lab has finally cooked up that lab results, specific antibiotics will be given depending on the strain of bacteria that has vegetated on the valves. Also, we want to take care of the inflammation, so antipyretics such as Tylenol could be given IV, PO. It depends on the situation. It may be given an IV route for safe measure. So another treatment style is surgery. The surgeon will typically repair the valve, or just may replace the valve in its entirety. So some important nursing interventions for endocarditis. Well, especially if the patients come out of surgery, they need to get their rest in. Their body must be extremely exhausted, especially their heart trying to overwork that vegetation that's occurring within the ventricle. So rest is very important. While they're in bed resting, it's important for them to either wear an SCD, TED hose, or if they're disagreeing to that, offer anticoagulants such as heparin, Lovenox. It just depends. It depends on the situation. As a nurse, it's your duty to auscultate heart sounds. What is S1 loudest at the apex? Is S2 loudest at the base? Are murmurs still occurring during S3, S4 when you're going back up with the bell of the stethoscope? How about labs? Evaluate labs. It's very important to trend labs such as the white blood cell count, ESR. Is there inflammation? Are those antibiotics working? Is that white blood cell count decreasing? Petechiae, you want to look under the mucous membranes to see if there's any brownish, purplish spots under the skin as well. Any Janeway lesions present, any Osler's nodes that we spoke about earlier. It's just important to monitor for that. Also, do they have any fevers associated with their endocarditis after surgery or after medical treatment? It's just very important to monitor for those signs and symptoms. So what are some important things to monitor for endocarditis? Well, you always want to monitor their vitals. You always want to trend it, either delegating it to the tech, or you going in yourself and taking those vitals, checking the heart rate, blood pressure, O2, temperature. Make sure to check all that. Auscultate. We want to know about their cardiovascular status. How's S1 sounding like? How's S2 sounding like? S3 and S4. Complications associated with endocarditis that we're about to go into right now. Some things to educate the patient about, depending on where the vegetation was. If the vegetation was on the left side of the heart, we're worried about systemic circulations, which include splenic embolisms, stroke, and renal embolisms. For example, splenic embolisms, if a patient complains of sudden abdominal pain that radiates to the left, and when you palpate their abdominal area is very tender, that's something to kind of keep in mind. As far as a stroke, on the other hand, if a patient may feel confused, weakness with fatigue, facial drooping, arm weakness, that may be indicative of a stroke caused by the vegetation on the mitral or the left ventricle, going out to systemic circulation. And then renal embolism, if a patient is feeling flank pain on their backside and they're bleeding while they're urinating, also known as hematuria, that's a positive sign of renal embolism, and that could be indicative of complications associated with endocarditis. Now, if a patient has a vegetation on the right side of the heart, it's important to monitor for pulmonary embolism, because that vegetation may break off, or that thrombus formation may break off, go travel through the pulmonary artery and into the left lung. So we want to know about if the patient has a sudden cough, difficulty breathing, also known as dyspnea, and sudden chest pain. We really want to monitor for a pulmonary embolism. Okay, so let's say the patient who has endocarditis was in ICU care and had a PICC line. So some important education tips to give to the patient is that when the patient goes home, it's important to wear an aqua guard covering that PICC line. So while the patient is showering, no foreign objects enters within that PICC line and goes straight to the heart, causing even more complications that they already came to the hospital for. So it's very important to educate that patient. Also, some other things to educate the patient about is oral hygiene is another important teaching for a patient who has endocarditis. Using a soft bristled toothbrush while brushing their teeth. Make sure to brush slowly and brush a few times a day to prevent any bacterial infection from occurring within entering the bloodstream. Also, you want to teach the patient to record their temperature daily for a 6-week process. So the reason being is, so if there's a elevated temperature within like a weekly basis, it might be indicative of the endocarditis may have returned, or patient's white blood cell count may have increased due to another bacterial infection. So it's important to teach that patient about recording their temperature.